before when the world is in your hands.
Good evening, everyone. We're so glad to see you all wherever you are at today, morning, noon, evening time. We just want to reach out to you all for this panel discussion on tonight, Good Grief. What is grief? We have with us on tonight, Dr. Khwaja. We have Nurse Ward on tonight, and we have Dr. Marquita on tonight. And we just are looking forward to a great discussion piece. And we hope that you all are enlightened. You all are enriched with the plethora of information that will come forth on tonight. So getting right into our discussion on tonight. First question of tonight: what is grief? We've been given the concept of many people are dealing with a cumulative of losses since the pandemic. And we're trying to embrace coming to the holidays, how to really deal with those losses. So going directly to you, Dr. Khwaja, and we'll move to Nurse Ward, and we'll move right to you, Dr. Marquita. What is grief? In your own words, what is grief on tonight, if you mind sharing?
So grief typically happens upon a loss of some sort, whether that's the loss of really anything. If it's the loss of a person in your life, or the loss of a beloved pet, or even the loss of a particular grade that you're looking for on an exam. When things sort of happen to you that are, to some degree or to a great extent sometimes, out of your control, the internal feeling that you feel, right? How you feel inside, where you feel a sense of sadness, or you feel a sense of loss, or even a sense of longing, that, oh, I wish that that person or that thing, or that, that whatever it is that was lost was back with me. And so grief is more like an internal feeling, how you feel inside, the feeling of sadness, the feeling of desire for that thing again. Sometimes it can even, border on like some levels of anxiety that, oh my God, I lost this thing, or oh my God, now what am I going to do? Or anger, and sometimes those are feelings that can go to a certain extreme, and and so there are different aspects of grief that we can talk about, but so I can conceptualize grief to be more of an internal, inside kind of feeling.
Okay.
Absolutely. So grief would be an internal feeling, a longing. To some, would it be could we say it's sorrow, a deep sorrow?
Deep sorrow.
Deep sorrow. I would definitely say deep sorrow. Nurse Ward, I'm so glad to see your smiling face, your perky, enthusiastic attitude. What is grief to you? What is grief?
It's good to be here. Thank you for having us. Grief is, to me, it is the emotional feeling, just as Dr. Khwaja shared. It's the emotional feeling, internal sense of loss for whatever it is, as he said, that you might be missing or have lost or experiencing at that moment. It is emotion. It's the emotion that's on the inside of you, and it's your personal reaction to whatever it is that you're experiencing.
So I'm glad you both you're saying something that really makes me think, and I'm gonna go directly to you, Dr. Marquita. I'm not going to leave you, but you all are saying something, because we also think of grief as just losing a loved one, but you are sharing that it can actually stem from anything. Wow. Okay, so going directly to you, Dr. Marquita, and we'll move forward from there. What is grief to you?
Well, I wouldn't necessarily add much to what the other two have already shared. It's definitely a feeling associated with loss. And along with grieving comes actions behind it. You had touched on about grief being anything. It really can be anything: loss of a job, loss of hope. Because usually when you have like a loss of a family member, there's hope attached to things you're looking forward to in the future. And if they're no longer there, then that means all those ideas or ideals are not going to happen anymore. right? So it really can be anything. You can even be grieving your childhood, for the things that didn't occur, things that had happened to you, things you missed out on. Even let's say you had to become an adult sooner than you would be expected to based on your chronological age.
You are blowing my mind tonight with just that. I always heard that grief was just limited to losing of a loved one. That's basically something that we've all embraced from childhood. We associate grief with just the loss of a loved one, but I'm writing down my notes now. I'm seeing that it could be the loss of hope. It can be regret. It can have so many emotions. So diving right into our next topic, if it can be deep sorrow, what is the difference between mourning and grief? Because the two can be used interchangeably. But on tonight, what is the difference? Or is there even a difference between grief and mourning? We're going to mix it up this time. Nurse Ward, I saw your hand pop up. And we're going to move to Dr. Marquita this time. And Dr. Khwaja, we're going to move to you lastly. Okay, Nurse Ward at this time.
Okay, yes. It's interesting in preparing for this, it really makes you actually look into what you already know, what you studied and all of that, and to think about, wow, is there really a difference? Or let's look into it and see what is it. And just in looking up the two words, as we said earlier, grief is the emotion that you feel that's internal, and the mourning piece is the external expression, is the external expression of that internal feeling. That's what I would share.
So grief would be the internal of the loss, and mourning would be the external, outward expression. I love it. I love it. Dr. Marquita, would you object, or do you have anything to add between mourning and grief?
I don't object. Kind of piggybacking off of what I had shared earlier, is that obviously grief is an emotion and there are behaviors that go along with that. And so what Erica is saying is mourning is the expression, which to me is behavior, right? I know we plan to talk about how people cope with grief. And so that's mourning. That's what's actually happening and transpiring. You're in mourning, which means you're also experiencing grief, right? So I agree with Erica.
Okay, Dr. Khwaja, how do you feel about grief and mourning with the two?
So I think that something that Dr. Marquita said earlier. I just want to sort of circle back around to that. Just to talk about grief a little bit more. She said that it's a loss of hope. And, a lot of times, where do we tend to see that? We tend to see that a lot of times in the loss of a child, right? So when a child passes away, or let's say that a parent had certain hopes and aspirations for their child, and then they end up having a child with a disability. That doesn't necessarily mean that, you've lost a child. You just have a special child, right? Who's got a special other ability that you just have to explore and figure out and find. But, as we as parents sometimes have certain hopes and aspirations, and in the loss of a child, or in the loss of an ability, or in the change of an ability, we might not have the doctor, we might not have the engineer, we might not have the president of the United States, anymore. And so sometimes people grieve the loss of that. And so that's what I just want to sort of describe what I understood from what Dr. Marquita said in terms of grief, like loss of hope. And so you can sort of extrapolate from that to many other different situations as well. Loss of a job, and so your loss of future income, loss of growth, and loss of hope, and so on and so forth. and so then we express that grief in many different ways, right? And that's what the two panelists, my co-panelists, are saying, that the grief is how you feel inside. The grief is making you feel like you want to cry and tear up and well up, and it makes you sort of want to do that. But then the mourning is when you decide that you want to wear black for that day, right? That's the expression of your grief, right? The mourning is when you want to, you call family members around and you sit by, you sit together and you're reading from your holy book, and that's a process of mourning, or you're making more supplication, or you're making more prayers, or you're making, and mourning is different in different parts of the world. Different people will mourn differently. Some people will go to the grave site. Some people will not go to the grave, or they'll do things. They'll have family over. They'll wear different things, or they'll do different customs after 365 days, 1 year later. That there's an expression of grief that happens, or remembrance, or a vigil, or things like that. So in certain in certain sort of large catastrophes, people will often put flowers down, like when Princess Diana, for example, died, or really, it's not even that, but really in some sort of disaster, people will bring, and they'll bring flowers, and they'll put them, or they'll stand hand in hand holding a candle, and you've got 100,000 people holding it. That's sort of the expression of grief. So that's how I sort of understood the difference between grieving, which is internal, that's your feelings inside, and then mourning, which is your external behavior and how you're expressing that grief. Now, there are some people, so I would say that there are constructive ways of mourning, and there are also destructive ways of mourning, and perhaps we can get into that as we go.
I think you all that's a great segment way to go into our next discussion. And we'll break for a few seconds, and we'll come right back to pick right back up in our next segment, which will be ways to deal with grief.
Are you or someone you know experiencing grief, moments of sadness, despair, or depression? Please call the National Suicide Prevention Lifeline at 1-800-273-8255. Text the text crisis line HOME at 741-741. The National Domestic Violence Hotline at 1-800-799-7233. The Military and Veteran Crisis Line at 1-800-273-8255. And remember, you are not alone.
We're back. We're so glad that you all are enjoying this discussion on tonight, the Good Grief panel discussion. I am overjoyed with the plethora of information that's coming forth. Ways to deal with grief is our next topic of discussion. So we've dealt with what is grief. We now know what grief is. We now know that it's deep sorrow, that you can grieve over anything. With where we are in this pandemic, many people are grieving. And we're understanding that there is a healthy way and there is an unhealthy way to mourn. So dealing with that process now, we're going to jump with Dr. Marquita this time. What would you say are some healthy ways for one to grieve? And after Dr. Marquita, I'm going to put it in your court. You can pick who will speak next, and we'll just play around with that real quick. Dr. Marquita.
Yeah, so for me, it's really hard to identify healthy ways and unhealthy ways just off the top, because to do that, I think we really would have to also talk about the phases people go through with the grief cycle to say this would be a healthy way of dealing with that or not. Right. I call them phases. A lot of times people will look it up and it'll say stages. I say phases of grief because you can be in any of them at any different point of time. All of them, 1, 2, you could be in one phase and then go back to another one. It just ranges. So there's 5 phases. which you've got denial, which I think is an easy one to identify with, because denial obviously is exactly what it sounds like. You don't believe that this event had occurred. So when people think of loss, and we'll use death as the example, that person didn't die. Let's say you got a phone call, unexpected death, right? You just talked to that person. There's no way. So even though someone told you they passed, you have to verify yourself, or want to, and might pick up the phone, call that person hoping they'll answer me like, no, I literally just talked to you, right? That's a very basic example. Or Dr. K had talked about, let's say you have a disabled child, right? You didn't think that's how it was going to go. Denial might be pushing that child to overcome their disability so much that you're ignoring the emotional or physical pain that you're causing the child, and not accepting them for who they are, right? That might be the denial. Another phase is depression, which a lot of people are familiar with, obviously being overcome with debilitating sadness. And that might be the stereotype, the crying that you see at the funeral, right? You can't eat, you're having trouble sleeping, and things of that nature. You got anger, which is also as it sounds, acting out. It can look like rage, hitting things, punching things, yelling at people you wouldn't normally be, being irritable, short-tempered, right? There's accepting everything that's occurred, right? So you acknowledge the loss, you acknowledge everything that you're going through. That one's pretty self-explanatory as well. And then the last one's bargaining, right? And that's kind of like I explain to people, it's almost like you're negotiating, so to speak. So if, let's say someone was on their deathbed and you are praying to God that you will do everything in your power to walk the straight and narrow, you'll go to church more, you'll do all those things if you just let this person, an individual, remain in your life. Okay. So those are the different phases. So when I think of healthy ways to cope, a lot of times people are thinking like, oh, I should exercise. Which phase would that fit for a good coping skill, right? It might be good for your depression. It also might be good for your anger, right? Other healthy coping is sharing with others how you're feeling, which belongs in kind of the acceptance category. Also, we know that sharing helps you feel less depressed usually, or less sad, because you're feeling more emotionally connected. Sharing can also help push you through denial. If you're saying like, I just can't believe this is happening, and talking to someone, they might be able to sit down with you and bring you to that realization. So those are just some quick examples for me. I don't want to take too much time up on mine.
You're Dr. Wolf. We're going to let you pick who's going to be next.
Oh, so sorry. Let's go with Dr. K.
Oh, so there isn't very much more left to say after Dr. Marquita. But one of the I guess slight distinctions. So the distinctions that I like to make. Oh, so before I go to the distinctions, one important understanding of the categories and stages or phases of grief and sadness is that just because you've gotten to acceptance doesn't mean that you can't quote unquote backtrack into one of the other phases. So all of the phases we sort of understand not to be linear on a straight line, but more circular, because you're kind of and really the circle is all interconnected. Each one is connected to the other, because you could go from denial to sadness. I call it sadness, and for personally for an important reason, and that's the next thing that I want to talk about. So you can go from denial to sadness, and then from sadness back to denial, and then from denial to anger, and then from anger to sadness, and then from sadness to acceptance and saying, okay, fine. But then it's like, no, why did this have to happen? And so you can go from one to another to another to another, and back and forth and back and forth. And so one of the is sort of, in my mind, one of the important reasons that I call it sadness as opposed to depression is because there's a difference between normal grief and depression, where when you grieve normally, what you typically tend to find is that for the first week or so, the typical person who's grieving normally will take 1 week and they just look like, oh my God, I'm so worried about this person. But then, maybe they just don't have an appetite. But then after a week-ish or so, the person might start still sobbing, but still at least come to the table, or maybe accept a bowl of soup or some sort of sustenance or some sort of nourishment from you. After about a month or two or so, you might start to see the person being able to go out of the house and start to kind of pull things back together and reassemble themselves and start maybe going back out to work. So maybe, but then that feeling can still remain, but then the outward expressions of mourning kind of start to give way to normal life again, right? After about 3 to 6 months or so. Now, but at no stage generally in normal grief is a person supposed to, longing to have your loved one return to you is one thing, but then longing to want to join your loved one wherever they are, that's very different, right? So then if at any stage of grieving, the person starts to become suicidal, that in whatever way I want to hurt myself, or certain extreme forms of longing to be with the person, maybe even taking certain steps that is not normal grief. And that if anyone is experiencing that, then they really need to call somebody. They need to talk to their clergyman. They need to talk to a counselor or friend, let somebody know. Or if somebody knows that, hey, my relative or my friend is experiencing just these types of, bordering on suicidal thoughts, then that's something that you don't want to just ignore. You don't want to just let the person be on their own. If they need to go to the hospital, they need to go to the hospital, right? So that's the important reason that I sort of make a distinction. I call it sadness because it's normal. Normal grief is sadness, but then abnormal grief or complicated grief, or depression is what I would call depression. So I would just sort of add that to what Dr. Marquita said.
Okay, Dr. K. I'm really fascinated with the concept of the circular. Grief isn't really, the process isn't just, linear, it's circular. And just the fact that people can interject with each other, find themselves backtracking was the word. I really think is a part where a lot of people are now with the pandemic. I want to make sure I'm saying it right. I think it's cumulative grief, where you have had a loss after a loss and it keeps going. You all can help me because I may be saying it wrong. But I believe a lot of people are seeing loss after loss after loss. And just dealing with that, I'm gonna jump directly to you, Nurse Erica. I really believe pushing to our next segment of religion, that really would tie in everything. So I just want to drop that in there. We're going to jump directly to religion after this. But Nurse Erica, you can take it away currently.
Okay. I think that in some aspects of grieving and going through grieving, that I think it needs to be said, and that hopefully those in the listening audience will be aware that grieving is a normal process. It's actually a process of allowing yourself to feel what you're experiencing and that it's okay. Because I think sometimes we, depending on how we handle grief or how we've been cultured or how we've been taught or how we've been raised, whatever our gender is, we maybe, feel like we have to fit some mold of how grieving needs to look, and that there is no look. There is no specific way that we should grieve, even though people put expectations on us as to how we should express grief, and that, you shouldn't, bring shame to your family by acting, totally out of your senses in the process of a funeral service or a family meeting or something. But that people need to know that it's okay to express grief and to give themselves permission to feel what they're feeling. And understanding the stages is so important, because sometimes, because of the lack of knowledge, we tend to think that we should meet some expectation of how grieving should be, and that these stages are perfectly normal. And it is, like you said, inner circling changes that can happen. You can be triggered by some fragrance, by some music or something that kind of puts you back in that sad space, maybe for a little while. I think it's important for people to acknowledge their pain and not feel like they have to act like I'm strong and I can handle everything, but that it's okay to have that feeling. It's okay to express that pain in healthy ways. And I think that would be probably some of what we might talk about in the next segment. But grief can trigger some emotions that you're not expecting, because if you don't know about the stages, you might think there's something wrong with you feeling angry. And especially in the faith community, how dare you be angry at God? But that's a real emotion. That who can you be angry with? And are you just angry because they're gone? Or how do you express that feeling that you're expressing and do it still in a healthy way? So that's important. I think the grieving process in and of itself is going to be unique to the individual, unique to the experience that they're grieving over. And I think that's probably an important aspect that we should consider when we're looking at how do you handle grief, how do you adjust to grieving, and how do you express those emotions. And I think people should look for safe spaces where they can go, people that they feel comfortable being able to, release those true emotions and feelings. I would say there is going to be some time where people do withdraw, but as Dr. Kwaja was sharing, that you have to be careful that that withdrawal doesn't continue to be perpetual to the point of depression, to the point where you're in so much despair that you're not even coping or even trying to reintegrate back into your normal life. So that's a real important aspect of grieving, which is where we do have to look out for each other and check on one another. And sometimes we feel like we should leave people alone when they're grieving, but sometimes you have to check in with folks so you can see where they are, if they are okay. So I think that's some few important tips to consider when we talk about how to deal with grief and the grieving process, and just accepting that it is normal and that it's okay to grieve. And nobody can tell you how to grieve, but we can encourage one another to do it in healthy ways, not to get to the point where maybe we're doing some maladaptive things or some unhealthy things in the process. So maybe that could be a segue to the next segment.
All right.
I wanted to add one more thing, just for people to know or be aware of. We're talking a lot about immediate grief reactions, and there is such thing as delayed grief. So you might have this emotional numbness once whatever the event is occurs, and it might take some time before it shows up. That's something sometimes like you might see in like kids, for example, children, especially girls, younger girls, they tend to be ones that have delayed grief reactions. And that was it.
I'm glad you all are sharing this, because going into our next segment, Dr. Marquita, you really did polish off our stages, so we don't have to touch that segment. Going into our next one with religion and therapy, that's a huge one. I really feel ties in together because when it comes to people needing help, a lot of times they turn to religious leaders. But I hope I may not get in trouble from the religious community. But I guess my question tonight is, what do you do when your religious leader could per se be overwhelmed with grief? And could they possibly be more so of an injury to someone who's hurting rather than help? And could it be that, we're pushing faith, but if I'm a person who needs to lose weight and I don't exercise, I can know the right diet, but if I don't eat the diet, it's not benefiting. So that's just the natural perspective of the body. What about the mind? If I'm not looking to someone who's a psychiatrist or a psychologist or reaching out to someone who can help me grieve, it's more so of an injury. So dealing with that importance of therapy and religion, what do you all feel they play a part, I would say, together rather than separate?
Erica, do you want to field that?
Yes, I'll start. I think a person's faith is really important, and everyone has different faith perspectives. Whatever it is that an individual relies on to give them the strength to get through what they're going through, I think is very important. In behavioral health, we talk about holistic care and psychosocial perspectives and the whole person and dealing with them as a spiritual being as well. And I think that being a behavioral health nurse since the 90s, early on, the spiritual perspective was not really looked at as much as it is now. So I think it's a good thing that people understand that part of them doesn't just go away, but they also have to look at the fact that if what they're attempting to do, with what we do when we cope in the faith community, we pray, we go to our spiritual leaders, our church families, our homes of our houses of faith for the strength that we need, and that is needed. But as Dr. Kwaja shared, even if the person isn't to the point of despair and depression, sometimes they just don't know the coping skills. Everyone hasn't been trained to help people through the stages of grief. And as Brother Jamel shared, that, even in our faith community, our faith leaders are human beings too. And they may not have been trained in some of the different mental health perspectives on assisting someone through the difficulties of grief. We know what we rely on from our holy books and what we rely on as our comfort, and that is important. It's not to be dismissed. But also there's a time when someone might actually need some professional help, and appropriate professional help is not a bad thing. There's so much stigma and taboo in different communities in the world, in America, about mental health and getting help with mental health, because I think people don't want to be labeled as being incontinent and incapable and not able to handle what they're dealing with. But sometimes we just have to accept that we need some help, that we may need to talk to someone who's trained to deal with the intricacies of some of what we're dealing with. Because just as Dr. Walker shared, Marquita shared, there may be triggers that happen later. There may be things that happen later, and you may think the person's fine, and then all of a sudden, and then it may be compounded, as Brother Jamel shared, where someone may have a cumulative effect because they may be experiencing pain from a previous loss that is brought to the forefront because of a current loss. And there's so much other trauma that a person might be dealing with that actually, when a person gets to the point of getting really depressed, sometimes it's because they're so overwhelmed internally, they're not functioning or capable of handling the emotions that they're experiencing. And then the external events that may be going on put them in a crisis. And so they get to the point where they're not coping. They're not coping well, or they're not coping like they normally do. And sometimes you just need some professional help to help you navigate that. So with that, I'd like to pass over to one of my brothers and sisters in behavioral health to share some more on that.
So I think also sometimes our religious leaders are also mourning at the same time. You know, if there's a loss in the community itself of an important figure, or you know, something happens, you know, for example, with if there's the loss of the actual, let's say, for example, the loss of the whole building, you know, for perhaps for unjust reasons or what have you. So everyone is mourning at the same time, right? Everyone is grieving at the same time, and so you know, so sometimes sometimes if someone doesn't necessarily have direct train, you know, so there's pros and cons where, you know, a lot of times we try to remain very stoic, you know, and very strong, and we feel like that is what the, you know, the person who's grieving, that's what they need. But maybe, you know, that sometimes there are people, you have to, I guess, read the person, and kind of find out a little bit about what that person needs. That is it somebody who, you know, it just needs to be told, hey, pull yourself up by your bootstraps, you know, and keep walking? Or is it somebody who just needs somebody to come up with their arm around the shoulder and say, hey, you know, tell me what's going on, and just let him go, and so on. So so sometimes sometimes there are multiple reasons why somebody may need to look outside of the safety, the safe community, you know, because I know Erica, because, you know, Erica is my religious leader, because, you know, so I'm just going to go to Erica. But then that's a very safe thing to do. What if Erica's also grieving and Erica's like, I'm not exactly sure what to tell, you know, Erica would come up with something to say, but then, you know, so then sometimes it might be useful to bring in outside help. And that's where, you know, as some professional services might be helpful. The other thing is that, you know, if the whole family is grieving, you know, then being able to maybe even go as a family, or have somebody come to the house as a, you know, to address the family, or if you feel like the family it's still going, I still feel the same heaviness and it hasn't changed, then maybe looking to get just getting a little leg up is what I call it, you know, just getting a leg up, somebody who just kind of boosts you up, and you all of a sudden you're like, oh, I didn't think about it like that. Because the professional, just like some of the clergy, you know, the professional has dealt with this for years with, you know, with different people, and kind of has experientially understood what has been helpful for different people, and they can give you suggestions, you know, if depending on what kind of therapy they're doing, but they could give you suggestions and say, hey, have you tried this, have you tried that, have you done this? The other really important aspect is, if there's a loss, don't forget that children grieve too. And a lot of times, what, you know, for whatever reason, we feel like children are not human. We feel like children are built of metal, right? You know, like the from the oh my lord, the Wizard of Oz, the Tin Man, right? As if children are robots, right? And they don't have a heart, or they don't have a brain, or, you know, or they can't feel emotion. And so you just tell the kid, oh, just be quiet and go sit over, you know, leave mommy alone. And so, for example, I know of a situation currently where, you know, mom has had a recurrence of breast cancer. She had beat it before. It's recurred now. And then it's metastasized, meaning it's spread from her breast to now her leg, and now she's starting to forget things. So we think it's metastasized to her brain as well. And in fact, the bone in her leg has shattered because of the cancer in there. And she says, no, don't tell my kids. And then dad says, no, don't tell the kids. And I'm questioning why not tell the kids? What do you, isn't, you know, if mom's going to die, aren't they going to find out that, hey, where's mommy? So, you know, so, you know, we try to protect our children, but maybe that's not necessarily a protection for them. Maybe that's a maybe that's not the right thing to do. Obviously, parents, you guys know your kids better, but what I would do is I would say, hey guys, come over here, you know, sit around me. I need to tell you that your mother is really sick, and we don't know what's going on right now. We have no idea, but we're all on this journey together. And or uncle so and so just passed away, and we don't know exactly what happened, but this is the news that I got, and let's all hug and let's all cry it out, and then let's all help mommy and daddy kind of figure things out, so that then we can go and visit and do nice things, and maybe cook and deliver food, and maybe get on a meal train. Maybe if they need some financial assistance, we can be the ones to deliver it, and then the kids will learn that, wow, this is how you help. And and it just helps them mature appropriately under your protective wing. So children grieve too. Children are human beings as well, just as you are.
I'm glad you both share that because it definitely, I really feel that's a very important piece with therapy and religion, because we've also dealt with we really didn't deal with the stigma of a therapist. I think Nurse Erica touched on it. And I'm sorry, did I skip you, Dr. Marquita? I did. Hold on, let me press pause, rewind. I apologize. Dr. Marquita, what is your viewpoint on religion and the importance of therapy? I do apologize.
No, it's okay. I think sometimes that's a loaded question in a way. But I have a couple thoughts based on some things that were shared. Number one, the two can be married. There is faith-based counseling not done by a clergyman. Okay. And so if that is something where your foundation is so strong that that's important and an important component to you to do therapy, you can seek that out. It's very much alive and well out there. Okay. My other thoughts about, you had brought up, what about if, let's say, the clergyman too might be in mourning? I really think of, as a psychologist, my ethical code and what I'm required to do. It's unethical for me to meet with somebody that would be, we'll say, triggering me because of my own personal issues. And so it's my responsibility to be aware of what's going on within myself to know whether I am a good candidate for the client or not. Especially right now in the pandemic, we are all going through it. So to say you're going to go to a professional, a clergyman, whoever, and think that they have not been impacted some way by the pandemic, it's impossible. And for that situation, I can only speak about how I handle it with people. And, I do a lot of correctional work in correctional facilities, and there are a lot of frustrations related to the increased restrictions and really honing in on what the staff are doing. And I have to remind them that the staff are going through it too. And so what you might be seeing is exactly how you feel. You're saying you don't get to see loved ones. I'm on the outside. I'm in the free world. I am not seeing loved ones. So I can relate to you. I understand you significantly. And to another certain extent, I think I had one supervisor that I really attached to this statement where he says, therapists, counselors, we are all wounded healers. Because there is something that attracts us to this field. It's probably something we have personally gone through that wants us to help others, show compassion. And so thinking that only the clergyman is somebody who could do that because of the experience of the community, I think is misinformed. And with that in mind, just keep in mind, you get to decide what your community is and who you invite into it. And so why could not the therapist be a part of your community? It does not have to be an outsider.
Excellent thoughts. Excellent thoughts, which would probably spin. I would also think it would be imperative for every parish to have a therapist. If not there as a member, one that they can direct people within the membership to, per se. A religious leader could discern something is off that they aren't specialized in. So I'm praying with you, but I'm going to refer you to Dr. Such and such. And then Dr. Such and such says, hey, that's something you now need to refer. We've gotten through this stage of the process. Now I'm going to refer you back to your leader so you can walk and navigate this part of life. I'm loving each and every last part of this. We've discussed a great portion of what we were supposed to say. Dr. Marquis.
Can I add something, Jamel?
Yes, sir. Yes, sir. Sorry, Dr. K.
No problem. I think that there's also a further extension of the taboo, right? When it comes to psychiatrists, myself being a psychiatrist, and the use of medication. So a lot of people don't want to go to a psychiatrist because they don't want to get put on medication. However, if you sort of look at some of the symptoms of depression, one of the things that I sort of describe to my patients is that do you feel like you just don't have the energy, the motivation, and the interest to get yourself up out of bed in the morning? So if you're not able to get yourself up out of bed in the morning, that means that you're not able to get to your therapy appointments, which means that you're not really doing the work of healing, right? And that's where I see medications can come in to be useful to sort of very quickly, or, not necessarily very quickly, but a little bit faster, kind of get you up and out of bed so that you can go and sit with your therapist and get the treatment that you need. So the way that I see medication is that it's an important piece of the discussion, but it's not the be all and end all of treatment, right? I see it as crutches, that your medication, your Prozac, your Zoloft, your whatever it is, are crutches to help you hobble to your therapist, who's your physical therapist, right? Or your mental therapist, so that you can do the exercise of the muscle in your leg to strengthen it, or do the exercise in your coping skills to strengthen your coping skills. And then eventually you can downgrade the crutches to a cane. Maybe you'll need a cane for a long period of time. Maybe you can get rid of the cane because you've gotten strong enough. Maybe you have to upgrade the crutches to a wheelchair. Hopefully you don't have to upgrade the crutches to a stretcher. But that's how I see medication, that medication should be a part of the discussion as well, especially if it's impacting and inhibiting your ability to get to the therapist. So that otherwise you're not doing the work of the therapy that's required.
Dr. K with the crutches analogy. I love it. I love it. Where we are now, we've navigated to the roller coaster or stages of grief. Well, some say stages. Dr. Marquita said process. We've talked about religion, and we've also spoken about the importance of religion and therapy. And Dr. K, you've brought in a great piece of discussion with medication, which was one that was needed. To say that some people need the medication is not really spoken of, but people definitely need medication as crutches, as your analogy. And we're now to a place of where we're the stigma. There's a stigma behind therapy, and we can cats out the bag. There's a stigma behind therapy. Where do we go from there? How can we deal with that stigma that some people would say that when you go for therapy, you're weak. Having a therapist, you're crazy. Can we just deal with that concept there? What is the stigma behind a therapist, and how will we navigate through the process of trying to divert people from seeing it in such a negative way?
The stigma really comes from the portrayal of mental health and mental illness in media. It's very misinformed and often portrays very extreme, unlikely cases. And so oftentimes I spend a lot of sessions providing education on what mental health is and what it isn't. And so stigma also comes from this worry of or feeling of shame, right? Or embarrassment that you need help or that you have to ask for help, right? You're always going to be asking for help throughout your life. And this is just another avenue. I promise probably every family has someone who has dealt with a mental health issue, every single one. There's no such thing as normal because everyone has a piece of them that is quote unquote abnormal. And so it's more of helping someone understand you're not alone. Individuals go through this all the time. And also understanding that just because you go to therapy, that does not mean you're going to be in therapy for the rest of your life. The goal of therapy is actually to not need therapy. That is always going to be the goal of your therapist, right? We want you to function independently. And so I think that's important for us to consider. Even in African-American populations, Latino, Latina populations, Hispanic, we're taught that we need to use the collective. It's a collectivist culture. So we rely upon the group. But, how do we rely upon the group too? Like the analogy of the clergyman who's going through something, if the group is going through something as well. And I would say the last thing is cultural paranoia attached to therapy. There is such thing as having some healthy cultural paranoia. And so oftentimes I find that most of the clients who select me, who share why, specifically identify my race as the reason, right? People want someone they feel they can relate to at the end of the day. And so if you feel like someone's too different from you, that might be your reason to also stray away. But have the understanding that, once again, you don't really know what each therapist we have all gone through unless they tell you, which they shouldn't, by the way. If they're telling you, you want a new therapist.
That's absolutely true.
But try to keep an open mind, even if they don't look like you. It's kind of, you're actually there to interview the therapist as much as the therapist is asking you questions, because at the end of the day, it's the matching that matters and whether your treatment is going to be successful.
If I could share something, a little analogy came to my mind when you were talking about that we will always need help in life. And that is true. We will always need help in life. There's always going to be a need for help in some aspect of our lives. But for whatever reason, we look at mental health because of the cultural perspectives, the representation in media and movies, and, how people may talk negatively about someone who acts a little bit different, and that difference is what causes us to not want to be that different person. So then we keep our mental difficulties to ourselves because we don't want anyone to label us as the different. Something's wrong with us. There's some impediment in us that we can't manage our lives. But when you need to pay your rent, let me break it down and make it real easy for you. When you need to pay your rent and you're a little short and you need some money, are you going to lose your apartment or your house because of your pride or your fear or concern about what someone's going to think about you? Are you going to find the right person who's going to care and understand and assist you with your problem? I think behavioral aspects of our own personal health and well-being, we need to take just that seriously, because our mind is what dictates everything else we do in our lives, and how healthy we are in our minds is what's going to assist us to be able to cope with life and other things that may come along the way. So when we don't feel like we're handling things in the best way, or we feel like we're not ourselves, or we feel like we're losing touch with who we usually are, or we notice, or people are trying to tell us that they notice something is different about us, that we shouldn't ignore that or be afraid of it, but that we should care enough about our own well-being to go ahead and look for the right person, the right assistance, like Dr. Marr shared, that you can actually, go to someone who's like you. You can go to someone who has maybe shares the same faith culture as you, and that you can get help that will be catered to specifically to the needs that you have, and that it's okay to ask for help. And the fallout or the consequence for not asking for that help is that we don't get better on our own if we're to the point where we are so in despair that we get depressed, clinically depressed, and we go down the rabbit hole. You don't get altogether well on your own. There's sometimes there's recovery. Of course, there's prayer, there's support, there's our social supports and natural supports with our families and all of that. But when we are at the point where we're not managing well, and we know we're not managing well, we need to be able to say, okay, this is a 911. I don't want to lose my house, because the mental house ain't nothing better than having a good mental house, right? Because, hey, everything else comes out of it, our minds. So taking care of our minds is important. And if our minds are not functioning like we usually do, it's just like when all of us biologically, as we get older, anybody who's as old as I am, you notice things a little different. You might not remember like you used to. That's why they got all that ginkgo biloba out there, right? All these different things that people are taking to help their mind to function better so that they can be swift and capable and feel like themselves. It's okay. And that's what we have to be able to. I really appreciate you, Jamel, for this tonight, because people need to know that it's okay to ask for help. And the Bible says you have not because you ask not. You have not because you ask not. And if you need the help, you need to ask for it, and it's okay to ask for it. And when you're feeling well and you're feeling better and you're feeling stronger and you've learned some new ways to deal with life, then you can pay it forward and help somebody else. So it's important to know that it's okay to not be okay, but it's not okay to stay in that state of mind. It's not okay to stay there. You've got to reach out to someone who can assist you, even if that someone is not professionally trained. Maybe they can help direct you to someone who can assist you further. And just knowing the red flags of when you need to do something to help yourself is really important. I think, and you all can correct me if I'm wrong, but I think if after a month, 4 weeks of kind of not being able to come up out of that hole, people should maybe consider looking into something outside of themselves for help. I don't know exactly if that's the exact correct timeline, but I think it's about a month of staying down deep in that hole. And I know over time, when you're really grieving a loss, that loss is so ever in front of you. But as Dr. Kwaja shared, at some point, you start to kind of reintegrate into the things that you used to do and start taking care of yourself. So I think when you're not doing that, and that despair is in front of you every day to the point where you're not functioning, you're not taking care of yourself, you're not having any drive or motivation to do anything other than just lay there, like Dr. Kwaja shared, that maybe that's the point where you need to say, I'm not able to do this on my own. And it's okay to be in that place and to accept some help.
I think that something that might make it easier, a little less taboo, would be, and not to belittle the work that anyone is and education that anyone has, but if it helps a patient, then that's fine. If you kind of just like Bill Gates, or just like who is it, Jeff Bezos, whoever these big CEOs are, just like some of these CEOs or heads of different organizations will go to get coaching, right? That is actually seen as a really amazing, wonderful thing to do, where you're sitting one-on-one with someone who's going to help you be a better version of yourself, right? Someone who's going to help you get past certain roadblocks and help you be successful, help you upgrade that mental house of yours, from a little shack to a mansion, right? That's where we want to go. So if you want to call me your coach, that's fine. Call me a coach. Hey, I'm going to visit my coach, right? And if it makes it easier for you to kind of feel like, okay, I'm improving myself. I'm getting better. I'm getting, I'm going to be a better version of myself. I'm going to be more successful. And if you see it, if you sort of see it like that, then maybe it makes it a little bit easier or a lot bit easier to, go and see your coach on a regular basis.
Coach K. Coach K. I have enjoyed tonight. You all have answered everything. Every question that I had, every question that I pulled from other individuals as we prepared for this, and the analogies, the wealth of knowledge, your expertise has been very pivotal in tonight's discussion. We've touched, and I was sitting here making notes. I hope you all didn't think I was texting or playing any Candy Crush or anything of that sort. But
I'm glad you clarified, Jamel.
Sir?
I'm glad you clarified.
Yeah. I saw my eyes when I'm like, yeah, let me just interject that I was definitely writing these notes, that grief is an internal feeling. I'm glad we touched on that tonight. And mourning is the external expression of grief. Dr. Marquita really shared that there was a loss of hope. And I hope those of you in the faith community can really grab from that perspective that if grief is causing you to question your faith, you might need to find a coach. I'm gonna just drop that right there. You may need to find a coach. And if the stigma behind a therapist, like Dr. K said, will scare you, you might need to find a coach. And we also understood that there's phases in grief, stages, phases, they coexist. And with those stages, there's denial, depression, anger, accepting, and bargaining. If you find yourself in those, again, with everything that was shared tonight, please seek professional help. If you find yourself dealing with anger, if you are questioning and want to find yourself in a place where you want to be with the person you lost, Nurse Erica, I call you doctor. Nurse Erica shared that your mental house needs to be taken care of. You clean your physical house out when there's trash in there. You clean the windows so you can look through them. And if your vision for your future is becoming cloudy, you need to clean it. If your mindset isn't as clear as you would like it to be, it's time to get some things out of there. So again, I'm glad to share this platform with each and every last one of you. And for the listeners, I hope you have enjoyed our discussion thus far. I look to see many of you in person. And for Dr. K and Dr. Makita, I'm so glad to meet you on tonight. You all have left a great imprint in my heart and in my mind. Dr. I'm gonna just call you Dr. Ward. I hope you have an amazing night. If you all have anything to interject, we can take that at this time, or if not, I salute each and every last one of you. The floor is open for expressions or closures at this time now.
I just want to thank my former colleagues for joining us in this session today, Dr. Kwaja and Dr. Walker. You all have been amazing. Thank you. The information was outstanding. And I appreciate you, Brother Jamel, for, again, allowing us to share this, because I think it's going to really help a lot of people, to give them permission, because sometimes people need permission, that it's okay that, hey, I'm not by myself, and that this is not a bad thing for me to, tell somebody that I'm dealing with something that I'm not dealing with the best. I'm not dealing with it, in the most healthy way, So this is excellent. And I hope that for those of you who are out there, that you will take advantage of the resources and information, or share it with other people who may need it in the community. And check in on each other, ask, are you okay? Let them know, let people know what you're noticing that may be different and that you're concerned. And just be willing to, not be afraid to tell people when something seems a little different, because sometimes we are in denial and we're not acknowledging in our own attempt to cope and manage. So I think it's important for us to check in on each other and to, help your brother and your sister.
As you were talking, Erica, one thing that came to mind is something that we've done in our community center, where sometimes we feel like we're the only one that's going through what we're going through. And that's usually not the case, that you're alone. When I was first sort of studying about depression, I think we learned that about 10 to 15% or 20% of the United States population is dealing with depression. That was a long time ago. I'm sure you three can say that, oh, it has gone up significantly. So imagine close to, Dr. Marquita can probably correct my numbers because it's sort of slipping my mind, but I want to say close to close to maybe a third to a half of the population in this country is dealing with depression. That's 300 million people is the population of the United States, and about 150 million people or thereabouts are almost feeling about just about how you're feeling. So one of the things that we did in our community center was that we would have support groups where you had to make sure that it was very private. It was very, no one knew who was coming in for what. And obviously you've got to advertise it in some way. So we figured out ways to sort of advertise it, but then have it in a different location so that people don't know who's coming in for what. But then support groups where people will see that it's not just me, but there's another like 10 people sitting around that are going through the same thing, and they each help each other. And I sort of become a little bit more free to say what I'm going through. And then it's not the therapist or it's not the coach that's sitting there telling us what to do, but it's my neighbor. Oh, it's my friend. Oh, it's, that he's saying that, or she's saying that, oh, you're going through that now? Yeah, I went through that a few months. That's how I was and this is what I did, and this is what I did, and this is what I did. And so a lot of times that's even much more effective than what a coach could tell you if you hear it from your friend. So if that's something that would be of benefit, then maybe our community centers can look into preparing something like that.
Dr. Marquita, did you have any closing statement before we wrap it up for tonight?
Not that I can think of. I just appreciate you guys having me. I love the discussion. I think it's an important topic, especially again in our current climate. And if anything, I would just encourage people to understand that you get to choose how you want to live your life. And those decisions are going to determine how you feel about it, whether you're happy, sad, mad. So if you don't like how you're feeling, you can make different decisions.
The freedom of choice. I enjoyed this discussion tonight. And to leave on that note, you have the choice to choose. And I pray and hope that you choose to live. And from Dr. K's advice, from his playbook, it's best to find yourself a circle of people in whom you can trust and share with. Did I say that right, Dr. K? All right. Well, I enjoyed you all tonight. You all have a great rest of your evening and a better tomorrow. You all have a blessed one. I hope that you all have enjoyed tonight's discussion. I pray that something was said that stirred within you, resonated within you, that you can glean from and take back to your families and your friends and those in whom you know that may be experiencing grief. I would be remiss if I left this moment and I left with not praying for those of you who are in the listening audience. I believe that as we get closer to the Thanksgiving season, that families should come closer together, that circle we spoke of tonight should be able to first start within the families of those in whom are experiencing whatever loss it is. So as we look towards heaven, Father, we thank you. We thank you for tonight's discussion. We thank you for this broadcast. We thank you for the panelists, for the information that was given on tonight. We thank you for this platform. We thank you, God, that we're still here in spite of what we may have experienced, in spite of what we may have lost. We have a testimony, and that testimony, God, is that we are still alive, and we are thankful for that. God, as we look unto you, as we leave this moment, we ask of you, oh God, with a sincere heart, that you will look upon these, your people, whom have heard the information on tonight, that you would give them how to deal with the loss, give them how to deal with the stages that they will have experienced. We ask that you would continue to look on those, oh God, in whom are in a place of depression, that you would lift up the hung down heads of your people, that you would mend those broken hearts, that you would touch families everywhere, that you would give insight and foresight. Let this be the best Thanksgiving that many of us have ever experienced. Even in the midst of a pandemic, we pray and ask that your people will find relief. Even in the midst of a pandemic, we pray on tonight that you would give many of your people release from depression, release from suicidal thoughts, release from the grasp of being entrapped in one's own mind. God, release families. Even on tonight, on the road to Thanksgiving, release families, oh God, so that communication will open up, methods of communication will open up, oh God, that walls will be torn down, that your people will be able to receive recovery for their life. We look unto you for a better future, a better time with family, a better time with friends, a better time in this life after the grief experience. I believe each and every last one of you will have an exceptional Thanksgiving on this year. I pray and ask that you continue to reach out to those in whom can help, that you will reach out to those in whom are your spiritual leaders, spiritual advisors. And for those of you who have heard on tonight, if you feel that you need professional help, we pray and ask that you would reach out to those tools and methods so you can be the best version of you that the world will be able to meet. Until we meet again, I love each and every last one of you. I salute you. Godspeed to you and your family. Peace.